So the breakthrough seizures are a huge issue. And actually the most common cause of breakthrough seizures is non-compliance. So patients take their medication, they miss a few doses, and then they have a breakthrough seizures. Breakthrough seizures also occur because we don't control the seizures well enough, even if they are taking their medication. But nevertheless, the commonest cause would be non-compliance. So if you look at breakthrough seizures as it relates to the effect on the healthcare system and the patient, obviously that's a significant issue. It applies much more to those patients who have generalized seizures, because that generally is more likely to result in a hospitalization or a visit to the emergency room. And obviously the cost of that to the healthcare system ends up being significant because it's cumulative. And the cost to the patient is also financial, but more importantly, every time there's a breakthrough seizures, it's a huge setback for the patient. It's a setback, number one, in terms of the expectation that it could happen again. Number two, it has an effect, especially in terms of work and home, and the psychological impact of the expectation and the fear that another seizure can occur.
Emergency room visits and especially hospitalizations are extremely expensive. So, one of those a year will far override the cost of a prescription. So the cost of medication is a very minor factor in treating epilepsy. So in addition to the cost of the healthcare system, is very disruptive to patients when they have one of these seizures. They can have injuries. They often out of work for several days. It's an extremely bad thing to have. And I have to say, I don't much like the term breakthrough seizure. That implies that somehow it's magic or mysterious, the reason they occur, but they always occur for a reason. Either the patient didn't take their medication, or they've got an intercurrent illness, or the medication's just not working. So this is not out of the blue. We always think there's got to be a cause.
Patients tend to be non-compliant for a number of reasons. One of the common reasons that they're non-compliant is side effects. They don't want to take the medication because the medication has side effects, and because they don't take their medication on a consistent basis, they're more likely to have seizures. So the use of medications that have better tolerability does improve compliance. But another thing that's important for compliance is the drug half-life. So if you have a medication that has a long half-life, if they do miss one dose and then they take the medication again, the effect of missing the dose is going to be much less. That's actually one of the advantages of perampanel, which is a long half-life. So even if they do miss one dose, as long as they go back to taking the medication again, it is somewhat protective. The medications that have shorter half-lives, missing one dose can have a much greater and much more significant effect and increase the risk of breakthrough seizures.
So studies have shown that only about 3/4 of patients with epilepsy take at least 80% of their medication, which is another way of saying, about a quarter of people don't really get the full prescribed dose. And it depends on a lot of factors. One of the factors is convenience. If you have to take a medication 3 or 4 times a day, it's very difficult to get all those doses in, as everybody knows who's ever tried to do that, even for an antibiotic for 10 days, but certainly for something you have to take for years. So once a day medication is ideal. These medications are not too bad in that regard. The perampanel is a once a day nighttime medication. Lacosamide is twice a day, which usually works pretty well, but once a day, other things being equal, is superior.